My name is Abhinav Gupta, and I'm a student at Yale University. Today, I'm going to be talking about how healthcare reform affects young adults, those who are 19 to 29. This group sometimes falls through the cracks in the healthcare debate, but they are a vital component of the reform effort. I hope to explain how reform will help young adults to receive affordable and accessible healthcare. Here's a brief overview of what I'm going to cover. I'll begin by talking about the current problems in healthcare for young adults. Then I'll describe the Affordable Care Act of 2010, the healthcare reform law passed by President Obama. The bulk of my presentation will detail the specifics on how the law will help young adults and a timeline for when certain provisions will be enacted. So to start off, let's talk about the current problems with healthcare for young adults. Right now, over 15 million young Americans lack health insurance. Being uninsured is a problem because it prevents us from receiving timely care. For example, over 2/3 of uninsured young adults report having no usual source of care, and 2/3 of the same population skipped receiving needed care. This is problematic because skipping care can lead to serious illnesses that may have been prevented earlier. In addition, apart from the physical harm, being uninsured is expensive. In fact, a full 1/2 of uninsured young adults say that they have problems with paying medical bills. 1/4 say that they are in debt because of medical costs. So it seems pretty important to be insured. So why do people stay uninsured? Well, health insurance is very expensive. Buying individual health insurance generally costs around $200 per month for a healthy young adult. It's hard to pay for health insurance with entry-level salaries or post-college debt. Related to this is the problem of employer-sponsored health insurance. Many employers provide health insurance because they are exempt from paying taxes on their employees' insurance. However, for part-time or entry-level workers, many of whom are young adults, many employers do not offer health insurance. As a result, young adults are forced to buy their insurance individually, which, as I mentioned, is expensive. Third, insurance companies allow children to stay on their parents' plans. However, this usually extends until age 18 or until college ends, at which time kids are kicked off their parents' plans. Again, they're left to buy expensive individual insurance. Last, young adults are often called the young invincibles by policymakers. Basically, this means that policymakers think that young adults are healthy enough to forego buying health insurance. Many times, young people think this as well. So because of our comparative better health and because of cost, we don't buy insurance. But is that true? Should we forego health insurance because we're too healthy? Because we are safe from illness, disease, and injury? In fact, our age group does have our share of health problems. 1 in 6 young adults suffers from a chronic disease, a long-term recurring disease like asthma, cancer, or high blood pressure. 1 in 10 suffers from a mental health condition, and 1 in 4 of us is obese. We've also got the highest rate of injury-related ER visits. And if you look at these numbers, costs for hospitalization are very high. Who can afford to pay over $12,000 for a visit to the hospital because of asthma or $9,000 for a torn ACL? A visit because of diabetes can cost over $25,000 and having a baby over $9,000. Insurance can help you pay for these high costs if something happens and can even help you prevent them from happening in the first place. Clearly, it's important to get insured. So with such high costs, over $200 a month, as I said earlier, how do we go about getting insured? Well, President Obama's healthcare reform law, the Affordable Care Act, helps us to do it. The goal of the law was to ensure affordable, accessible, quality care to all Americans. By 2019, his plan hopes to insure more than 32 million Americans, of which half will be young adults. The law aims to do this by reforming insurance companies to provide cheaper prices, reforming hospitals to provide better quality care, and by expanding government programs. In all, it aims to provide health care as a basic right for all Americans, in a climate where many students and low-income people do not receive the care they need. So how is it going to help us? Well, there are 6 main parts of the law that affect us: insurance age expansion, insurance regulation, Medicaid expansion, online exchanges, federal subsidies, and college plan reforms. It all sounds pretty complicated, but it's really not once you get through the jargon. In the next few minutes, I can explain to you just how health reform will help you. First, the law mandates that insurance companies must allow adult children to remain on their parents' policies until age 26, unless they receive insurance from their employers. As I said before, some companies used to drop kids at age 18 or just after college. This provision is important because employer insurance from parents can be significantly cheaper than buying individual insurance. This part of the law was enacted in 2010 and has already benefited more than 600,000 young adults. In the next 2 years, over 1.7 million people will also gain insurance from this provision. Along with this, the law enacts many reforms to insurance companies. Previously, companies could charge higher premiums or deny coverage if patients had pre-existing conditions like asthma or high blood pressure. Why would they do this? Because these people would need expensive care, and so companies would have to pay more. The law bans companies from using such conditions to price their plans. Next, it bans companies from dropping coverage when a person falls sick. This is called rescission and allows companies to retroactively deny coverage when someone gets sick in order to not pay for their healthcare services they need. The law bans annual and lifetime limits as well, which were methods that companies could use to limit coverage. Some companies would set a cap on the amount that they would pay doctors for healthcare and left patients to pay the rest themselves. This practice will happen no longer. Also, insurance companies can no longer discriminate based on gender. Previously, women's insurance was much higher than men's insurance. Specific provisions to cover maternal and reproductive health will also be mandated for insurance companies. And last, the ACA mandates that small insurance companies must spend at least 80% of patients' premiums, 85% for large insurers, on direct medical care, and less on administrative waste. All these reforms hope to make quality health care more affordable, accessible, and fair for young adults. The next provision in the law that increases coverage for young adults is the Medicaid expansion. Medicaid is a government-sponsored insurance program that provides coverage for low-income people. Under the new law, anyone under 133% of the federal poverty level is eligible for Medicaid benefits. This is $14,400 per person, or $29,270 for a family of 4. This is helpful for us because we have the lowest incomes just after high school or college. This will give us access to healthcare during the time when we really struggle to make ends meet. After it is enacted in 2014, Medicaid expansion will cover an additional 8 million young adults. Young adults will not have to pay for Medicaid, which will cover us for our healthcare expenses until we surpass the income limit. So just to recap, there are 3 specific provisions in the law that will help us. The age limit for dependents increased to 26, insurance reform, and Medicaid expansion so far. Another provision that affects us is the creation of online insurance exchange markets. Insurance policies are very difficult to buy. They're complicated and full of technical language. These markets, similar to Orbitz or Expedia for flights, will help consumers to directly compare insurance plans. In this way, insurance companies will compete on price and benefits, making individual insurance cheaper. These exchanges will provide easy-to-understand plans in different tiers of benefits: bronze, silver, gold, and platinum. The bottom line is that these markets will help us get cheaper quality coverage. Thus, for those of us who won't get insurance from our employers, our parents, or through Medicaid, we can look to the exchange for cheaper policies. Furthermore, small businesses with fewer than 100 employees will be able to use these exchanges. Young adults are much more likely to work in small businesses than in large corporations, and so will receive more employer-sponsored coverage. In fact, businesses with less than 25 employees will receive tax credits for using the exchanges, a move that will really motivate them to provide insurance to employees. But what if buying insurance in these markets is still too expensive for us? Not to worry. The law includes subsidies for individuals who buy insurance through the market exchanges. These subsidies will be offered to those who make between 133% to 400% of the federal poverty level, which is a range from $14,400 to $43,000. This equates to $29,326 to $88,200 for a family of 4. The subsidies will range from the difference between 2 to 9.5% of income and the cost of the silver plan. How it works is that for those making these salaries, the law wants each person to pay no more than 9.5% of his or her income on health insurance. Meaning that if you make just over $14,400 per year, you will be eligible to receive the difference between 2% of your income and the cost of a silver plan in your state exchange. It sounds confusing, but we'll go through some real-world examples in a few slides. This part of the law is important for us because 75% of young adults fall under 400% of the poverty level. The insurance exchange and subsidies are projected to insure about 5 million young adults. For students, the law provides specific reforms to college health plans. Over 1.6 million students are insured by college health plans. That's over 11% of all college students. Before, many college plans had very low benefits for the amount that you paid them and discriminated based on pre-existing conditions, gender, and age. Reform bans these discriminatory practices and mandates that college plans provide free preventive care and offer coverage to all students. So these are the ways in which reform helps us. By letting us stay on our parents' policies, by reforming insurance companies, by expanding Medicaid, by giving us subsidies for the health exchanges, and by reforming college health plans. Now I'm going to talk a bit about a part of the law called the individual mandate and then about future steps needed. As part of the law, the individual mandate requires everyone to have health insurance or have to pay a fine. Sounds kind of unfair, no? I mean, why do I have to buy insurance? Well, the reason is that insurance companies have to pay a large amount of money for people when they get sick or for those with pre-existing conditions. So to prevent insurance companies from dropping people, rescission, or from charging high premiums to people with chronic diseases, we must add everyone into the mix. In this way, we offset the costs of people who have major health expenses. And at the same time, if we get sick, we will have the security that insurance companies can pay for our health care. The individual mandate is the only way to keep premiums affordable and to end unfair discrimination. The law has a penalty to ensure that people get insured. If you do not buy health insurance, you will have to pay a penalty of $95 or 1% of income, whichever is greater, in 2014, which will rise to $695 or 2.5% of income by 2016. So when will everything happen? Well, the age for increasing the age of dependence to age 26 has already been enacted. The reform for college health plans will happen on January 1st, 2012, and the Medicaid expansion and markets will start on January 1st, 2014. Here are a couple of examples of the differences between 2009, when the law initially passed, and 2014, when it will be fully implemented. Take David, for example. He's a 23-year-old who just graduated from college and is working. However, his employer does not provide insurance for him. Now imagine that Dave recently fractured a rib. In 2009, this would have meant that he would have paid all of the hospitalization costs himself, as he would have likely been uninsured. Now, however, in 2014, his costs are much lower because he is able to stay on his parents' policy. The cost of a fractured rib is around $9,000. In 2009, he would have had to pay the full amount, but now he may just have to pay the deductible of $1,000. It's a savings of $8,000. Now take the example of Mary. She's been out of college for a few years and is now working and making $23,000 per year. She does not receive insurance from her employer, but needs it because she is asthmatic. So she looks to buy insurance from the individual market. We will take the estimated price for a yearly individual cost of health insurance to be $3,391. In 2009, she would have had to pay for this all by herself. But in 2014, with the new federal subsidies, she will only have to pay 7.5% of her income on insurance, that's $1,874, and receive a subsidy of $1,516 to help her pay for her plan. This reduces her healthcare costs in half. These are just two of the many scenarios in which reform helps young adults. So now, is everything fixed? Well, not quite. There are some so-called catastrophic plans, which are very cheap but provide minimal coverage until you pay a lot of money. These are unfair but have been preserved in the law. These, we hope, will be phased out in the future. Furthermore, the regulations on college plans do not apply to self-insured plans, only fully insured plans. Fully insured means that colleges get their insurance from third parties, and self-insured means that they insure them by themselves. Long story short, not all college plans are subject to the new regulations. For true reform, we must have all colleges comply. Last, healthcare costs are rising very fast. It's important to stay aware of what you're paying for, even if it is subsidized. We must stay healthy instead of visiting emergency rooms, because that's what costs us, costs taxpayers, and raises premiums. In the end, this law helps young adults get access to quality, affordable healthcare. It's important to stay informed, healthy, and to get insured. It's complicated, but in the end, the law really helps us to become healthier individuals. For more information about healthcare reform, please visit www.doctorsforamerica.org. Thank you.